Alright, The Occupation of Nursing by me, Damien Moran. Yes, I am going to be a male nurse. Here we go. Here are some of the careers in nursing. Cardiac nursing, perioperative nursing, obstetrical nursing, and oncology nursing. Let's start things off with cardiac nursing. Cardiac nursing is a specialization that works with patients who suffer from various conditions of the heart. Excuse me 1 second. Alright. Cardiac nurses help treat conditions such as unstable angina, which is a condition in which your heart doesn't get enough blood flow and oxygen and may progress into a heart attack. Cardiomyopathy, heart muscle disease, coronary artery disease, congestive heart failure, and cardiac dysrhythmia, or irregular heartbeats. And they work under the direction of a cardiologist. Cardiac nurses work in many different environments, including coronary care units, or the CCU, intensive care units, or the ICU, operating theaters, cardiac rehabilitation centers, clinical research centers, and cardiac surgery wards. All cardiac nurses are registered nurses, yet some may choose to receive certification. The cardiovascular nurse certification exam is offered by the American Nurses Credentialing Center. Salaries range from $73,713 up to $95,300, and that's for all these categories are registered nurses, so the salaries are in the same range. Obstetrical nursing. Obstetrical nursing deals with women who are pregnant, trying to become pregnant, or have just delivered a baby. Obstetrical nurses perform post-operative care on a surgical unit, stress test evaluations, cardiac monitoring, vascular monitoring, and health assessments. Obstetrical nurses must possess specialized skills including electronic fetal monitoring, non-stress tests, and medication administration by continuous intravenous drip. Obstetrical nurses also work in many different environments including medical offices, prenatal clinics, labor and delivery units, postpartum units, operating theaters, and clinical research centers. Perioperative nursing. Perioperative nursing is a specialization that works with people who are having invasive procedures. Perioperative nurses help provide prenatal care and testing. They care for patients experiencing pregnancy complications, care during labor, delivery, and care of patients following delivery. Perioperative nurses work closely with surgeons, nurse anesthetics, surgical technologists, and nurse practitioners. Perioperative nurses perform pre-operative, intraoperative, and postoperative care primarily in operating theaters. Pre-operative meaning before the operation, intraoperative during the operation, and postoperative after the operation. They also must know how to perform stress test evaluations, cardiac monitoring, vascular monitoring, and health assessments. Perioperative nurses typically have basic life support and advanced cardiac life support certification. Oncology nursing. Oncology nursing is a specialization for the care of cancer patients. To become certified, nurses must have an RN, meet specific eligibility criteria for nursing experience and specialty practice, and must pass a multiple choice test, for example, the AOCNP, or Advanced Oncology Certified Nurse Practitioner, or the AOCNS, or the Advanced Oncology Certified Clinical Nurse Specialist. For the Advanced AOCNP and AOCNS certifications, a nurse must have a master's degree or higher in nursing and a minimum of 500 of supervised clinical practice of oncology nursing. The AOCNP certification also requires successful completion of an accredited nurse practitioner program. Now, great employer in our area of these professions, Shands Hospital, right here in Gainesville. Shands Hospital at the University of Florida is the primary teaching hospital for the University of Florida College of Medicine. Shands Hospital, as we all know, is located in Gainesville, Florida. The hospital is nationally renowned and provides coronary care for critically ill patients. Shands Hospital was founded in 1958. It is the only hospital in the state of Florida that serves patients from every county in Florida. Shands Hospital is a 576-bed hospital. Centers of excellence located within Shands Hospital consist of cancer, cardiovascular, neurology, and transplant. Outside Shands Hospital, the U.S. and World Report consistently ranks Shands Hospital at the University of Florida as one of the finest hospitals in their magazine's 2004 issue on America's Best Hospital. Shands had 12 different departments which earned recognition. Those departments and their national rankings are cancer, the 34th best in the nation, heart and heart surgery, the 41st best in the nation, kidney disease, the 28th best in the nation, urology, 22nd best, orthopedics, 48th, neurology and neurosciences, 44th, ear, nose, and throat, the 25th, digestive disorders, the 22nd, geriatrics, the 25th best, gynecology, the 32nd, respiratory diseases, the 37th, and pediatrics, the 28th. Nobody's got nothing on Florida. Also, numerous firsts have occurred at Shands Hospital at the University of Florida. Those firsts include Florida's first open heart surgery performed in 1959, Florida's first total hip replacement surgery in 1970, Florida's first burn intensive care center in 1978, Florida's first adult liver transplant in 1986, Florida's first adult lung transplant in 1994, and the United States' first embryonic tissue transplant for spinal cord repair in 1997, and much, much more. But with Shands' outstanding reputation, there also leaves a substantial margin of error and room for their own issues. Nathan Crabb from the Gainesville Sun recently reported that the University of Florida's College of Education and Nursing are very much considering to terminate bachelor's degrees offered to nursing students at the university. But they aren't completely shutting the door on our future nurses of America here in Gainesville. They are letting Santa Fe College take more responsibility for teaching undergraduates in nursing. I believe this is a great way for the University of Florida to relieve themselves from their budgeting issues that I did not mention before. I'm sorry about that. They're doing it because of they're cutting down on it because of budget issues. So they're relieving themselves from budgeting issues while helping Santa Fe grow and progress into an even better and bigger college. Here's the layout of Shands. It's a pretty big hospital. And if I'm not mistaken, I think they're building, it might be built now, an animal hospital, right across, a small animal hospital to be exact, across the street. Alright. So what's going on in nursing today? What's the buzz? Nursing shortage expected to continue rising in the near future. Since as far as most of us can remember, nursing shortages have always been an issue. Although nursing is a respectable and financially beneficial profession, the sick have always been able to outnumber the U.S. medical staff members. The shortages have become so severe that hospitals in the U.S. are beginning to hire nurses from India, Indonesia, and other foreign countries to come work as nurses in the U.S., which is not bad, but, you know, we can't fill them ourselves.